Good morning, everyone, and welcome to the 2020 virtual edition of Longhorns on the Hill. Thank you so much for tuning in today. My name is Dorothy Guerrero. I'm the VP of Communications for the Texas X's and the Editor-in-Chief of the Alcalde magazine. We have a fascinating speaker to kick things off. As the pandemic has just upended every aspect of our daily lives, Vice Admiral Raquel Bono has been managing the crisis as head of Washington State's COVID-19 healthcare response team. She was appointed to this role by Governor Jay Inslee on March 22nd. Before she retired from the Navy with many honors and decorations, Vice Admiral Bono served as the director of the Defense Health Agency. She is a highly trained trauma surgeon who served in both Desert Storm and Desert Shield. In 2017, she was named a distinguished alumnus of the University of Texas. Please welcome Admiral Bono. Good morning, Admiral Bono.
Good morning. Good morning, Dorothy. How are you?
Good, thank you for joining us today.
My pleasure, my pleasure.
So I want to start by just asking, how are things in Washington State right now?
So we've gotten to a really good place where we were starting to bend the curve, flatten the curve. And the efforts right now have been looking forward to seeing what the fall season might bring in terms of the flu and COVID-19. As you're probably aware, numbers are starting to rise in other areas. And so just as we've seen in Europe, now we're starting to see a slight uptick in numbers. But for the most part, a lot of the work that we've done in Washington State has been really to work together to try to get a better handle on PPE and testing.
How is PPE right now?
Yeah, there still are some supply chains that are still challenged and strained. And so one of the things that Washington State is looking at is whether or not we can do a public-private partnership to develop a more consistent supply chain for PPE across the state.
So we interviewed you back in April for the X's, and you're about a month into the role. I'm wondering, how has, much has changed since then. How has your outlook changed on the coronavirus since then?
Yeah, it's, we've learned a lot. We continue to learn a lot as more and more information comes in. We know where we need to really shore up our efforts, especially with those populations that are most at risk. And those are the ones that are in congregate settings like nursing homes or long-term care facilities. We also know that there's a real strong push to try to find a way that we can get back into the economy and start businesses up. And so what's changed since we first talked in April is a lot more collective understanding of what people need to do in order to try and continue to move forward. I think one of the big things that we've learned across the country really is that COVID is here for a while. It's going to be here for a little bit longer. So our best bet at this point is to learn how to live with COVID rather than trying to wait until COVID is over.
Yeah, we hear a lot of people these days talking about getting back to normal. And do you ever think about what is normal going to mean? Do you?
Yeah, I think it's, people have talked about the new normal, getting back to normal, or when this is over. And, I think we're redefining that now. In order for us, if you look at what's happening with professional sports and even some of our college sports, people are looking at in terms of how do we protect each other, and so you're seeing the mask wearing, and even if we do restart activities, it always has to be with how do we protect others, and that's where the social distancing comes in, continuing to wash our hands. But then there's also a lot more testing, and that's what we're seeing more and more, is that in order for us to know with any kind of certainty if we have safe areas, how well can we test people? And I recently was on my email and I noticed how Texas is testing students and also being able to test others in the community. And I think that's where a lot of the attention is going, is how can we test as many people as possible?
What have you, so you've been following Texas' response and a massive university, getting everyone back to business. What's your review of everything so far?
Oh, I'm very proud of Texas. I'm always very proud of Texas. But Texas, the size of the school itself, being able to take care of the students in that way and doing it at that scale, I think is an extremely important effort. And I applaud. I applaud what the school is doing. I also feel that it's very smart and it's prudent that students are wearing masks when they have to be out, taking advantage of online educational opportunities, and doing what they can to make sure that they don't become a part of the transmission cycle.
What do you tell, you have a lot of knowledge and inside information. What do you tell your family on a daily basis to do to stay safe?
Yeah, I mean, it's worse for my family because I really do come down hard on them. So, my parents are like in complete lockdown pretty much. And even when we do go visit them, it's always with our masks on and, either outside or being very distant from each other. I recently had a chance to see how my parents were doing in San Antonio. And it's, you really want to keep your gatherings small. You want to be always washing your hands, and especially around elderly relatives and wearing the masks. And so my family knows how strict I am on these. And so fortunately, I've got a niece who has also adopted my stringent posture. And she's the one that goes around reminding everybody to make sure their mask covers their nose.
Very important. What do you think the most important thing is that we've learned about the disease since you were appointed in March?
Yeah. Dorothy, I think this is probably the biggest lesson that I've learned, and we're seeing it over and over again. And that is that there isn't any one element across the community or across the sector that can take care of this. In other words, it's not just the science community. It's not just the pharmaceutical community trying to develop vaccines. It's not just the PPE. What I'm learning is that this is taking an all of society approach to managing and dealing with coronavirus. And it's because that this thing is so, it can affect anybody. And because this is something we've never been exposed to, we're all at risk. And so the only way that we can really do a credible and impactful way of containing this, isolating it and containing it, is to make sure that everybody is doing their part. And so a lesson that I learned and that we really put into play in Washington State is that everybody has a part, has a role to play in this. And it's not, as I said, it's not just the medical community, it's not just public health. I think a great example is how Texas themselves, UT, is a part of the testing effort and is doing what they can to make the campus as safe as possible. And if everybody did what Texas is doing on the campus, on the 40 acres there, and they replicate it in each of their communities and create these safe bubbles, then I think we have a much better chance of getting through this and keeping as many people safe as possible.
You have a long career of jumping into stressful situations. Okay. I'm wondering if there's any parallel or skills that you draw on today from your experience as a surgeon in the Gulf War. Is any of that applicable now, running this response team?
Oh yeah, I mean, I wouldn't have thought about it in the beginning, but actually being deployed in the first Gulf War was probably one of the most impactful experiences that I'd had. It was one of those epiphany moments that I had, and it's, of course, you think being deployed to a war, of course, that's going to have an impact. But the insight that I gained was about myself. And what I learned about being in that Gulf War was that it's real easy to fall into a pattern or a posture where you want to complain about how unlucky you are to be in a war or in a combat setting. But what I learned about that is when you have people like myself, myself and the other surgeons or the other doctors in this fleet hospital that I was assigned to, when other people hear us complaining, it gives others permission to complain about what's going on. But it was one of those moments when I was complaining, and I think I was doing a really good job of complaining. I'm not proud of it today, but it was one of those moments when I was complaining, when I realized, I could probably do a lot better if I channeled my energy into actually making this work the way it's supposed to and work better for the broadest number of people. And that's the lesson I took to Washington State with the coronavirus, is that this is a time for action, and that action is really something that needs to be scaled. It needs to be impactful. And the best way to create that impact is to see how well you can align everybody's actions and responses so that we're all pulling in the same direction. And that was the big lesson that I learned in that first Gulf War. And so I've taken that with every job that I've gone into and every opportunity, is how do you create the kind of momentum and synergy that's needed to make the impactful change to better the situation.
How long do you think you'll be managing the response team? How long does something like this, when will you know it's time? When will you know that you're done, I guess?
Well, it's a great question. I actually have just left Washington State, and it was, there comes a time where you put in place what you can, and I have the greatest confidence in Washington State because they've got very engaged leadership throughout all the sectors. They're in the private sector, the business community, the health community. Their representatives and their elected officials across the board are all engaged. And they're as ready as they can be. I think we've learned so much. And so while it was difficult, saying my farewells, because I spent about 6 months there, it was time for me to come home. So I just recently came back to where I am now in Alexandria, Virginia, and continue to monitor this from afar, having all the faith in them, but also very anxious to see how the trials are going with the vaccine, and hoping that we can continue to create that collective impact across all the sectors and across all the communities to keep people safe.
I think everyone's kind of bracing for a rough fall, and we know that with the flu that it's going to be that there could be an uptick in cases, but I'm kind of thinking past fall now and wondering, what do you think spring could look like? Do you think that schools might be more normal, or are we looking at a whole academic year in summer? How do you kind of frame it now?
Yeah, that's a great question. A couple of things you have to consider is the flu season actually extends into April, into most places. And people think it's just the fall, but it's actually starting now, and it goes until about mid-April in many places across the United States. I think what we're going to do is we're going to take the lessons of this fall, what's happening now, to decide how well we can advance and how quickly we can move forward in the spring. And so I think a measure of success will be how well the transmission rate can be controlled and kept at a very low level on campuses, as an example. If Texas and other schools can crack the code on keeping the transmission rate as low as possible, how well they do that will help decide or help determine what does the spring look like, and what can we do? What other things can we safely restart? So a lot of that is going to be predicated on how well the fall semester goes.
Is there anything that keeps you up at night with all the knowledge you have?
Well, I think that what keeps me up at night is figuring out, how can we get more people involved in making this work? How can we make sure that everyone understands that they've got a role to play, even though it's a small role, it might be a small role, and just understanding that even the smallest action can have impact. And I think that where I come up with when I'm thinking about that is trying to make the information as clear as possible, as understandable as possible, And then also helping people realize that this is something that is in our communities. It could be right next door. It's not very far from us, and that what we learned in the early stages of the pandemic is that it can spread really rapidly, which is why very small actions are impactful and meaningful.
You talked about small actions making an impact, and here we are at Longhorns on the Hill. I'm wondering, how do we get people with so many issues going on in the world right now to focus in on higher education, public higher education, and its value right now when there's a lot of competition for issues and big causes?
Yeah. You know, education is just so important of any kind. Education and the ability to know how to assimilate new information and incorporate that into your understanding of what's going on is so important. I am so grateful for the time that I spent on 40 acres because while, you know, college was and going to school at Texas was probably one of the most exciting things to do. It was very tricky because you guys taught me how to actually assimilate new information, to think and be very discerning about how I would sift through data and turn that into knowledge. But more importantly, is how to turn that knowledge into action. And that was, you know, I always credit Texas for helping me get to that place where I realized, okay, it's not just enough to learn something new. It's how do you turn that new knowledge into action? And, you know, and I know that when I was honored with being selected as a distinguished alum at Texas, you know, I shared that when I went to Texas, I had the feeling that if I could be successful at Texas, then I would have the beginnings and the makings to be successful anywhere else I chose. And so it was being able to do that at Texas and to come into, you know, my early adulthood that really set the stage for everything else that I did after that.
How would you tell your fellow alums to put their feelings about Texas into action? What can they do to support their university right now?
Well, you know, it's always really easy when you know, we get the chance to watch our Longhorns play on the weekend, whether it's football or basketball or any of the sports. But there's any effort that we can make as a collective group of alums of making sure that others have access to education and that others are able to grow into their own using Texas as a platform is going to be a benefit. And I think now more than ever, it's so important to make sure that people have access to really quality education and to be able to have the right kind of learned professors and you know, former national leaders who are so accessible to the students, to the Longhorns on 40 acres. So I think that as a group, we've got a very powerful alumni association, and that there's many of us, and we are in all walks of life. Anything that any one of us Longhorns, any of us Texas Exes can do to make sure that others who follow us have a better shot at having access to the education, especially at Texas, is going to be, I think, is going to be powerful, and it'll be amplified really easily.
So I have a few more questions for you, but I want to remind our viewers that you can submit your own questions for Admiral Bono, and go ahead and do that now, and then I will select them for her. So I asked the scary question of any expert is, what keeps you up at night? We always want to know that, but I also want to know when it comes to coronavirus, what gives you hope? What do you know that maybe we don't know?
Well, I'll tell you what gives me hope is, you know, there are a lot of people that are working on a vaccine, and I will say this: we should not wait for the vaccine. We need to learn how to live with COVID-19 safely, and that's why I very much applaud what the school is doing and what others are doing. to make sure they're advancing social distancing, hand hygiene, and wearing masks. But one of the things that's really struck me is the research and development companies that are working on vaccines is they're working together. And these are companies that are typically in competition with each other. And that's something that when they come together and they share what they're learning about vaccine development, it can only lead to a more quicker solution and a more effective solution. That was something else that I saw happen in Washington State, which was so impressive, and that is that everyone there realized that if they could work together, they could make sure that no one entity failed, and that's what I think is so encouraging, is that in a weird way, this is bringing some of us together. And allowing us to work in ways that really synergize and amplify the good efforts and the impact and the progress we're all making. But it needs to be a very thoughtful way of bringing together. And so I think that as I watch the pharmaceutical companies as they're developing vaccines, they're working very hard, but I really appreciate and admire the very high standard of safety that they're maintaining in all of their efforts to do that. And I think that's important. It's, you want to be able to not only have a very effective vaccine, but you also, in the process, you want to be very transparent about how you're making it safe for everybody.
What about treatments in addition to vaccines? Are we getting close on any treatments, you think?
Yeah. Well, we're learning more about that, and they've had some pretty successful efforts with remdesivir, which is something that we've used for patients who are on ventilators. We're also finding that there are certain patient populations that seem to respond to the use of steroids, which is also very helpful. But in terms of finding that one silver bullet that really does help with treating coronavirus, we're not there. We're not there yet, and we may not be. There's certain things we still haven't found the cure for. We don't have a cure for malaria, and so I think our better posture is to make sure that we learn how to live as safely as possible with coronavirus, and then when we have the vaccine, is make sure that we can get that distributed as broadly as possible.
So the questions from the viewers are rolling in now.
Okay.
Here's one. What is the most important lesson you learned from your time on the 40 acres?
Oh gosh, well, there's so many lessons. It's hard to choose one. I think the one that I like is that being on the 40 acres showed me that having a very successful college career or college experience meant being able to fully enjoy all the offerings that Texas gave me and provided me, from participating on varsity swimming, to being able to attend all the intercollegiate activities, and then having access to some amazing professors and being able to walk up to them and talk to them. So I think that probably the biggest lesson I learned from UT was just put yourself out there and avail yourself of all that Texas has to offer, or in any situation, avail yourself of what's available there, and don't back off. Don't shy away from taking advantage of that. And I mean, Texas had it all out in front of me, and I had to overcome my shyness and my reticence at first to do that, but it was a great place to learn how to do that.
What advice would you give a freshman Longhorn who's in their first semester on the 40 acres, and a strange one at that?
Yeah, so this is going to sound a little strange, but this is probably one of the best times to get very inventive and creative. As a freshman, your situation is very different from the freshmen that have been there in the past. It's even different from when I was there as a freshman, very different, I know. But this is probably one of those times where you're in a unique situation as a brand new freshman. Help us figure out how to do things better. What would make learning online more effective for you? How does distance learning become more engaging? What would it make it a better experience for you? And then as you're going through your day-to-day, understanding, and experiencing that you have to maintain social distancing, but a large part of what you learn in college is how you interact with other people. Help us figure other ways to do that, whether it's a different aspect of social media or there are different ways of bringing groups together safely. We need everybody to kind of help us think through all of these challenges and think of it in terms of how do we still create a sense of community while we're keeping everybody safe, and what is the best way to do that? So I'd encourage the folks, the students that are there now, help us be a part of the solution. Share your ideas, because I know that you have access to a lot of things that are not on our screen on a daily basis, and you can help us define what would work for a lot of other people.
I have another question from a viewer. What's the best way that you've found to encourage people to wear masks and work together?
Yeah, I think that's a great question. And what I like to remind people is, as a surgeon, I wore a mask all the time. And the reason I wore a mask was to protect my patient. I mean, that's the whole reason I wore a mask. That's the reason why we wear masks today. It's not so much when I go outside and I wear a mask, when I'm moving around people. It's not so much I'm trying to protect myself, I'm trying to protect others in case I might be transmitting either germs or viruses to them. And I think that's the thing is that it's keeping others safe. That's the important part about wearing a mask. It's not to keep yourself safe, it's to keep others safe. And if you think about that with your own family members, it's and how you want to keep your parents or your grandparents safe. I think most of us would want to keep our family members safe, and most of us would want to keep our loved ones safe. So I think the best encouragement I can give to people for wearing masks, it's for everybody else. It's not for you. It's to protect everybody from you, and just assume that you might be bringing something that's harmful to another person.
Our next question is, why is testing so important? Is it really about the number of positive cases, or are there other reasons we need to be more tested?
Yeah, because that's a really great question, and I'm so glad somebody asked that. Testing is so important because we know about the coronavirus that you can be spreading the disease before you even have symptoms. So if you're not testing, you're not even able to know who's got the virus. And once you can expand your testing, you can start identifying where the virus is and where it's likely to spread. And when you have that kind of information, then you're in a better situation to control it or contain it so that you can limit the spread to other people. And that's why testing is so important. And just having that sense of who's got the infection currently and who is likely to get the infection is what we find out with testing.
This is a good question. We clearly weren't prepared for this pandemic as a nation. You talked about working together through this pandemic.
Yeah.
Do you think we are prepared for the next one? And are there some specific things we need to put in place to be ready for it?
Oh, great question. I'm glad that wasn't one of my professors when I was going through school. We have talked for decades about a pandemic, and one of the things that I had done in my military career is I'd worked in the PACOM area, the Indo-Asia Pacific area, and we used to do these things called war games, where we would say, here's a scenario, how would we respond to it? And many times the scenario we would use for our war game was a pandemic. How do we want to respond to pandemic? Because we recognized that there were going to be situations where an infection could spread very rapidly across the world. Like the incubation time for a certain disease could be the 6 hours it took to fly from one country to another. So I think that we can never be too prepared for a pandemic. So the best thing that we can do now is take a look at what we should have done better and how we might have done better and apply that to what might happen in the future. I think the biggest lesson that we're learning with this pandemic is that while we said there were some interfaces and that we had a system of care and a system of response, it wasn't as smooth or as easily executed. It was a little clunky in how we did that. The ability to share information across all the people and all the sectors involved was something that we can always do better. Information sharing is something that we all could do better with, no matter what the situation is. But for the next event, and I believe that there will be other disease events or medical emergencies similar to this, the best thing that we can do is take our lessons here and start applying them now, and just recognize that you can't be over-prepared for a pandemic.
This question is from me. I'm interested in you're talking about the war games with the pandemic. Were there things about COVID-19 that were novel, didn't ever show up in those scenarios you gamed out?
Well, I think the one thing that we did not do in the war games was that we didn't necessarily choose something that was so novel that nobody had ever been exposed to. We had actually looked at a pandemic through the lens of a variation of something that we knew. And so we kind of gave ourselves a leg up on that, because if it was similar to something that we'd already treated, that we might have a cure or a vaccine more readily available or a treatment readily available. We didn't really challenge our imagination enough to take on a novel strain that nobody had been exposed to.
This is back to our viewer questions. What is your leadership philosophy?
My leadership philosophy is that it takes a lot of self-awareness. You have to be very conscious and conscientious of how your impact as a leader has on other people, and recognizing that leadership is really more about how effectively you can influence others to want and desire to pull in the same direction. And I think that for myself, in order for me to kind of understand the impact of leadership, I had to understand my own response to certain things, and how I might either end up conveying that to others. For example, recognizing that something like a pandemic can be very anxiety provoking. It's new, it's unfamiliar, and in that situation, it is so important to understand the role of leadership in being able to communicate, share information, create an environment of understanding and trust, and then being able to describe activity and actions and behaviors that everyone can participate in towards a solution. And so part of my leadership that the military helped me develop, and that I've implemented over and over again, is understanding myself, being able to create shared understanding with others, and then being able to help describe collective behavior and actions and impacts in ways that people see their role in being able to do that. And so I tend to be very transparent. As I've told my daughters, it's a lot easier just to tell the truth, because that way you don't have to remember what you said. So I tend to be very transparent, including when I'm feeling uncomfortable about something. So I think that it helps people understand that they're not the only ones in this situation.
Our next question is a good one. With all the ways that the pandemic has changed our lives, are there any positive changes you see staying around even after we have a vaccine?
Oh, yeah. I hope that people hold on to the connections you've made as a result of the pandemic. I know in our family, I have 3 grown daughters. They're all in their 20s. They live outside the house. But what this pandemic has taught us is that, we can get together on a weekly basis. We have our family Zoom calls. And I think that's something that is so invaluable. I mean, I thought our family was close to begin with, but this pandemic has even drawn us closer. I also hope the one thing, this is an odd observation, but the one thing that I do hope happens and stays with us beyond this is that because so many of our transactions are now virtual, when you have a meeting, you can't all speak at once. You actually have to go and have somebody facilitate and call on people individually. And what I notice that does is it creates the space for everyone's voice to be heard. And I want that to continue after the pandemic because, on our virtual meetings and our Zoom meetings or WebEx or whatever medium you're using, or whatever platform you're using, it forces you to go to people individually and give them time to speak. And it makes everybody else mute their microphones to listen to what that person is saying. I think that's so incredible. I have learned so much during those meetings, and I hope that is something that we keep beyond this pandemic, the ability to let everyone speak and listen to them.
So our last question from the audience is, since you lived in Washington for a while and you just came back to Virginia, what do you miss most about Texas?
Well, you can't get any good barbecue anywhere else but Texas. I'm not going to lie. So I'd have to say that, actually that's one part is the barbecue. But I'll tell you, what I miss the most is that Texas is friendly. I miss the people more than anything. I can be away from Texas for weeks, months, years on end, and I come back in and everyone talks to me. It's, Texas is friendly. It's Texas friendly. And I miss that the most, where I can be walking in my parents' neighborhood and people who I don't even know, who I don't even recognize, are saying hello to me. And it's like I've never left home. And that's what I miss most about Texas.
So we're going to wrap things up. We're asking our viewers this week, our participants in Longhorns on the Hill, to share the ways that UT changed my world. So I have that question for you to end things. How did UT change your world?
UT showed me the art of the possible. UT just really opened my eyes and allowed me to believe and to learn how to make a difference. And Texas was so impactful in helping me see that. And that's how Texas has changed me.
Well, Admiral Bono, I want to thank you so much for waking up early and joining us here today. What I want our viewers to know is that whenever we need her, Admiral Bono answers the call for the university. She is always happy to talk to Longhorns and share her expertise. So we really appreciate that. Thank you so much.
Thank you. And hook 'em, everybody.
All right, folks, now we're going to go over to our advocacy program manager, Rachel Osterloh. She has a few announcements about the rest of the program. Thank you all.
As we wrap up today's Longhorns on the Hill kickoff, make sure not to make this the last step that you take this week. There are 2 additional conversations to attend. Tomorrow at noon, plan on attending a one-on-one talk with Chuck Harris, the Executive Director of the Texas Exes, and UT Austin President Jay Hartzell. And then on Thursday, make sure you tune in for a conversation with CNN correspondent Rosa Flores and Dean Clay Johnston of the Dell Medical School and Dean Sharon Wood of the Cockrell School of Engineering. Also, we hope that you will join alumni around the nation in showcasing what it means to be a Longhorn. Congress is currently making important decisions about how to fund federal programs, including higher education initiatives. And we as Longhorns and friends of the university have the opportunity to demonstrate to Congress just how valuable investment in UT can be with our personal stories. Please plan to visit the Texas Exes website or social media for all the direct links to share your story and to help us tell the incredible story of UT Austin. You can also text Longhorn and story to 52886, like on the slide, to receive links to take action. These actions are so quick and simple to take, and they will require fewer than 7 minutes of your time. Thank you so much for joining us this morning and for your time to help advance UT Austin. Hook 'em.